We are live.
Very well. Thank you very much. And I'd like to welcome everyone to our Board of Health meeting this morning, including those that are tuning in from wherever they are, as well as our staff that are here to answer any questions. You are advised that our meetings are webcast live on the city's website and temporarily archived. Presentations and reports considered that this meeting are available on the city's website, and members of the public can contact the clerk's office to acquire documents in an alternate form if they so wish. As per usual, electronic devices are to be switched to a non-audible function, and we have a 5-minute time limit, which we will adhere to during our meeting today. Madam Clerk, you will confirm the quorum is present.
Quorum is present, Mr. Mayor.
Thank you. And Madam Clerk, are there any changes to the agenda that you're aware of?
No changes to today's agenda.
Okay, thank you. Could I have a motion to approve the agenda as presented then? Moved by Councillor Pearson, second by Councillor Ferguson. Thank you. All in favor? Hopefully you're all on eScribe. If not, let me know. Thumbs up from Councillor Powers. And the vote is up.
Councillor Pauls, are you able to vote on eScribe?
No? Thumbs up then?
I'm on eScribe, but it doesn't come up, but thumbs up.
Okay. In the meantime, if you can do thumbs up, that'd be great. Thank you. And we'll wait for the tally on that. Some confidence it will be approved.
Just have to mark. And that carries 11-0.
Thank you. Could I have a motion to, or are there any declarations of interest? Sorry. Anyone? Going once, going twice? Councillor Partridge, yes?
Not a declaration of interest, but I do have to step out for a phone call at around 10:15, 10:30. Thank you.
Okay. Thank you for that, and we will welcome you back when you're done. Thank you. No other declarations that I'm aware of, so approval of the minutes of the April 4th meeting. Can I have a motion to approve it? Moved by Councillor Marula, seconded by Councillor Partridge. Thank you. Any comments or questions on the minutes? Not seeing any. Thank you. All in favor then? Whoops. That came and went. Did you get my vote, Lauren? And thumbs up from Councillor Powers. Councillor Pauls, are you able to vote? Thank you.
And that vote carried 11-0.
Thank you for that. So we are at the overview of COVID-19 activity in the city of Hamilton. We have Michelle Baird doing a presentation, and Dr. Bart Harvey is here for any detailed questions beyond that. So I'll turn it over to Michelle, and Michelle, you'll introduce all of our contributing partners that will give us the overall overview. Good morning and welcome.
Thank you. Good morning, everyone. We're here today with a brief update on where we are with COVID-19 in Hamilton. Next slide, Erin. Yeah. I'll share a bit of an overall status with you today, and then our epidemiologists, Erin Rodenberg and Ruth Sanderson, will share the COVID-19 status report, as well as an updated SCARS and forecast. And finally, Melissa Bixa will share the vaccine update with you this month. Slide. Over recent weeks, we have begun to see signs that we are nearing or perhaps even reached the peak in COVID-19 transmission in this current wave. Our reported cases and test positivity have plateaued since mid-April 2022, and our wastewater indicators, while remaining high, are showing signs of decreasing in recent samples. In terms of hospitalizations, although this is a lagging indicator, updated forecasts indicate that admissions due to COVID-19 will peak in early May and decline to pre-Omicron levels by July 2022. I'm going to talk to you a little bit about vaccination. So for vaccination coverage in Hamilton as of April 28th, 2022, 90.5% of individuals 12 years of age and older have received 1 dose of vaccine, with 88.2% having received 2 doses of vaccine. When we look at our 5 to 11-year-olds, 53.4% have received 1 dose, while 38.1% have received 2 doses of vaccine. 57.7% of individuals 18 years of age and older have received a 3rd dose, while 67% of individuals 40 years of age and older have received a 3rd dose. And we're looking here specifically at the 40-plus group, paying some specific attention there, because those individuals 40 years of age and older, due to their age, have an increased risk of severe outcomes, be that hospitalization, ICU admission, or death if infected with COVID-19. 64.8% of eligible individuals 60 years of age and older have now received a 4th dose of vaccine. For the fourth dose, it is important to note that more individuals are becoming eligible than we have uptake. So the number becoming eligible is increasing faster, if you will, than 4th doses are being administered. So we will see this number decline over time. Due to waning immunity and the fact that COVID-19 is continuing to circulate in our community, it is important, now more than ever, that people get all of the doses of vaccine that they're eligible for. So overall, I'm going to give you some key messages and behaviors. We shared these at our April session, and all of these are still very much relevant today. It's important that all of us are aware of our own risk factors and know the current community context when making choices about behaviors and activities. Hamiltonians are continued to be encouraged to use protective measures to reduce serious health consequences from COVID-19. As mentioned earlier, vaccination continues to be the single most important thing you can do to protect yourself against serious outcomes related to COVID-19. We're encouraging you to wear a mask when you're indoors or if you're unable to distance. If you have symptoms of COVID-19 or really when you're sick, you should stay home. There is now treatment available, and so it's important that you speak to your healthcare provider in advance and know if you're eligible for treatment, and if you are, how you access the treatment. And then, of course, continuing to practice physical distancing where possible. And that's the overall update for us today. On this point, I'm going to turn it over to Erin Rodenberg, who's going to talk to us about the COVID-19 sit rep today.
Perfect. Good morning, everyone. Before I proceed with this usual situation report on our COVID-19, I just want to state that this update includes data until this past Friday, April 29th. And the update today will be very similar to what we've shown previously, and it's also similar to what information is provided in our weekly transmission summary that our team collaborates on and posts on the Hamilton Public Health Status of Cases page, which I'd recommend consulting on Wednesdays just to get that updated understanding of the local rates of COVID and how you can protect yourself. So today I'll go through some of those indicators and just give us an overall update. So you'll remember that the last few Board of Health presentations, we reintroduced our reported cases as one of the ways that we see the trends of COVID-19 transmission in our community. It's still true that these case counts are an underestimation due to the changes in testing criteria, so we do look closely at the trends in our cases rather than the actual number of cases. So here I've provided the trend in our reported cases since November 1st so that we can see when this wave that we're in right now began. If we look in between the first Omicron wave and the current wave, we see a low point around February 23rd. So as such, when I'm sharing the trends for the current wave that we're in, we'll be looking from February 23rd onwards. So looking here, when we look closely at our most recent trends in reported cases, we can see that we're seeing consistent increases from February 23rd until about April 11th. Since April 11th, we had seen a plateau in our 7-day average of reported cases, around 180 new cases per day, and we've most recently seen the beginning of a decrease in this number. The 7-day average of newly reported cases as of Friday was at 157, and this plateau and decrease suggests that we may be seeing signs that that we're nearing or have reached the peak of transmission in this current wave. And as Michelle mentioned, while I haven't generated a percent positivity slide for this presentation, I did want to highlight that we are no longer seeing increases in our percent positivity either, which is adding to that idea that we've made it to the peak of transmission for this wave. Another monitoring tool that we have is our wastewater data. This graphic depicts the results obtained from the wastewater samples plotted over time since November 1st. Wastewater signal is the number of copies per gram of COVID-19 identified in the wastewater, which is then normalized to help account for environmental changes that occur in the sewer shed. So I first want to flag that we're cautioning making direct comparisons between the waves that are seen in the wastewater data. This is because there is some information to suggest that the viral load may be different for each wave. So for instance, the differences between those seen during BA1, when BA1 was most prevalent, versus BA2. So hence, we're focusing mainly on the trends of the wastewater data rather than the magnitude. So we've now received wastewater samples up until April 25th. And the signal does remain heightened when we look at our 3-day point average. However, our latest sample dates are fluctuating and they do see an overall decrease from the height that we had seen during this wave. So next, looking at our hospitalizations and our severity indicators. So I want to outline these, which lag behind our cases, our test positivity, and our wastewater signal. And just a reminder that hospitalizations, these are new hospitalizations that are people with permanent addresses in the city of Hamilton, and they're in hospital for COVID-19 related medical treatment. So I've first shown again the trends since November 1st, so we're able to see the current wave in comparison to the last wave. We do see heightened hospitalizations over on the right-hand side of the graph, though at a much lower level than what we had seen previously. When we zoom in on the COVID-19 hospitalizations specific to this wave, we can see that the new admissions were increasing consistently, but have since seen some fluctuation. Our most recent data shows that there were 3.9 new hospital admissions per day reported to Hamilton Public Health. And as we saw that plateau of high case activity, we might also expect to see hospitalizations remain heightened for a period of time before decreasing again. Additionally, this slide looks at intensive care unit or ICU admissions. As described in past Board of Health presentations, again, these are new admissions and they're for people who have a permanent address in the city of Hamilton and who are in the ICU for COVID-19 related reasons. So again, showing the current and the last wave from November 1st onwards. And if you look on the right-hand side, you'll note the low ICU admissions that we're seeing currently. So overall, the ICU admissions do remain low. You can see that when we focus in on the most recent time period. As of Friday, there were currently 0.4 new ICU admissions per day reported to Hamilton Public Health Services. And I didn't create a slide specific to fatalities, but I did want to highlight that fatalities are showing very similar trends, remaining low and stable currently. I also want to highlight, as I've mentioned before, that it's important to keep in mind that ICU admissions and fatalities are lagging. And so when we see those increases in cases and hospitalizations, we might expect to see increases in ICU admissions and fatalities as well. So this slide provides some additional context to these severity indicators of hospitalizations, intensive care admissions, and fatalities by looking at the risk of being hospitalized, entering the ICU, or dying due to COVID-19, comparing those who are unvaccinated, which are the gray bars, to those who are vaccinated with 1, 2, or 3 doses of a COVID-19 vaccine. So the chart on the left depicts the outcome of hospitalization, the chart in the middle depicts ICU admissions, and the chart on the right depicts our fatal outcome. So the key message here is that the risk of experiencing a severe outcome due to COVID-19 continues to be lower for those with any number of vaccines compared to those who are unvaccinated. And you can see that when you compare the gray bar to any of the colored bars. We also see that the third dose of the COVID-19 vaccine provides the most protection against these outcomes when we look at that orange bar for all 3 outcomes. Data from December 1st onwards suggests that those who are unvaccinated have a 4 times greater risk of becoming hospitalized for COVID-19, a 5.7 times greater risk of being admitted to the ICU for COVID-19, and a 4 times greater risk of dying due to COVID-19 compared to those who have received third doses. And the last thing I wanted to flag on this slide was just that yellow bar in our fatality cluster over on the right. You'll notice that that does appear to be lower. And I just want to mention that it's important to note that we're working with very small numbers there. So just to interpret that visual there with a bit of caution. And finally, what we always end off with, this is our number of active outbreaks reported to Hamilton Public Health Services. Most recently, as of April 29th, there were 31 active outbreaks declared, 20 of which were in long-term care homes, 6 in hospital settings, 5 in supportive housing, 2 in a shelter, and 1 in a correctional facility. And though we're seeing increases on that right-hand side of the graph in the number of declared outbreaks, and therefore the number of cases that are associated with outbreaks, when we look at our severe outcomes that are linked to these outbreaks, such as hospitalization or death, we're actually not seeing those increases yet. So the 7-day average of new outbreak-associated hospitalizations is actually sitting at 0 as of Friday. And so before I pass it over to Ruth for our latest forecast, I just wanted to summarize the current local COVID-19 situation here in Hamilton. So though we're seeing good signs that we may have reached the peak of transmission, I do want to mention that our indicators do remain heightened. And so considering this and the known continued pressures that we're seeing in our healthcare systems, it's still very important to continue to practice those protective measures that Michelle Bard had highlighted for us at the beginning of this presentation. And that concludes our COVID-19 situation report, and I'll just pass it on to Ruth now for our forecast.
All right. Thanks, Sarah. And good morning, everyone. When I last provided a forecast to the Board of Health on April 4th, you may remember that we had only begun to see increased COVID-19 transmission in Hamilton, fueled by the increased transmissibility of the Omicron subvariant BA.2. And at that time, we were forecasting a resurgence of Omicron that would drive hospitalizations up, but would remain below the previous Omicron peak and might continue above the pre-Omicron levels past June. Today, I've updated that same forecast out to the end of August. This new forecast includes the continued increased transmission impact of BA.2, as well as the counterbalance of the Ontario rollout of fourth dose boosters. You'll see that mobility continues at levels below pre-pandemic levels, a good thing, and perhaps an indicator that Hamiltonians have made choices to reduce their personal risk where feasible. Most importantly, this forecast that now focuses on the more severe outcomes of hospital admissions and deaths indicates that the peak of new hospital admissions of Hamiltonians is likely right around the corner and is predicted to occur in early May. While hospital admissions will start to decline soon, levels above pre-Omicron levels will likely be sustained to the end of June and then recede to pre-Omicron levels over the summer. So I'll begin by showing you what has been happening with mobility in Hamilton. As you saw last month, community mobility has increased slowly since mid-January. If you look on the far right-hand side, you can see that slow increase. But it continues to remain low, well below the red line. That's the pre-pandemic level. And as I mentioned, this is a good thing. It indicates that Hamiltonians may be limiting their contacts, which helps to prevent some transmission. As of April 24th, it had leveled off at 19% below pre-pandemic levels. Now looking at workplace mobility. Workplace mobility has leveled off at 13% below pre-pandemic levels. You can see on the far right that it dipped down during the most recent holiday. And as of April 23rd, it appears to be moving back up to that level. It was at 19%. On April 23rd, below pre-pandemic levels. So again, that's a good news story. Where feasible, it appears Hamiltonians are continuing to prevent workplace transmission. So looking at the scenario now. So, as I explained, I have one updated scenario that's been updated in some important ways. Apart from keeping mobility at lower levels, I've also incorporated the continuation of masking and higher risk settings to June, out to June 11th. And I've increased the growth of BA2 such that we're now assuming BA2 was at 95% of cases as of last week, April 30th. The vaccinations out to the end of this year have been updated to include the booster doses at the slower rate the anticipated than we had previously anticipated, and what we're now seeing in Hamilton. As usual, we have used the most updated case, hospitalization, and death data available to us as of April 25th. And so, as I mentioned, I'm now going to show you the forecast focusing on hospitalizations and deaths. Overall, new hospital admissions of Hamiltonians are predicted to peak at approximately 6 per day in early May, which is earlier than we previously forecast at the April 4th board meeting. There is, of course, still some uncertainty of the trajectory, and admissions could peak at nearly 8 per day or stay down below, down to where we are about now at 4 cases per day. 4 hospitalizations per day. We anticipate approximately 280 new admissions between now and the end of August. Now, taking a look at admissions by age group. As I've highlighted before, the hospital trajectories by age have differed by both timing and magnitude over the wave. Initially, this wave seemed to be affecting younger age groups. When I last shared the forecast with the Board of Health, it looked like the 60 to 79-year-olds would drive new hospital admissions. We now see that transmission has spread in our community within those 80 and older. And you can see that in the bottom right-hand orange graph. Forecast now predicts that these two age groups combined, the 60 to 79-year-olds and the 80 and over, so in total those 60 and older, will make up over 85% of new hospital admissions between now and the end of August. Now looking at intensive care unit admissions. So this is likely the good news story of this wave, and as Aaron already indicated, to date, ICU admissions have remained low. The more severe outcome of ICU admissions is forecast to increase slightly above pre-Omicron levels, but will peak at under 1 per day. So actually at about half an ICU admission on average per day. The forecast predicts 20 new ICU admissions among Hamiltonians, and over 60% of those admissions are predicted to be in those 60 to 79 between now and the end of August. And looking at deaths, as expected, deaths are predicted to lag behind hospital and ICU admissions and peak in late May. The forecast predicts approximately 42 additional deaths between now and the end of August, and most of those deaths will be in those aged 80 and older. Now to sum up, the forecast to the end of August 2022 indicates that new hospital admissions due to COVID-19 are reaching their peak among Hamiltonians. Peak admissions are forecast to occur in early May. The peak is predicted to be about half the previous Omicron peak level. So that's to say just below 6 new admissions per day on average, compared with the Omicron peak levels of approximately 13, but could get as high as 8 admissions per day or stay as they are now at a low of 4. Intensive care unit admissions are forecast to peak at less than 1 per day. Hospital admission levels are forecast to return to pre-Omicron levels by the end of June. Infections are forecast to increase in older age groups after first peaking in the younger age groups. Vaccinations continue to be important as we consider the impact of waning immunity and a potential fall wave. Now I'll turn it over to Melissa Fixa.
Thank you so much, Ruth. Next slide. So I'm going to begin today's COVID-19 vaccine update with just highlighting our total number of doses administered to date in Hamilton. So this is estimated as of end of day, April 28th. And since the initiation of our rollout, over 1.25 million COVID-19 vaccine doses have been administered in Hamilton. Since the start of April, there has been an increase in doses administered that has been driven by the expanded fourth dose eligibility amongst 60 plus year olds, as well as First Nation, Inuit, and Métis communities. Fourth doses now account for the vast majority of the daily doses administered in Hamilton, and just over 24,300 fourth doses have been administered in Hamilton, currently averaging just over 774 doses per day. Next slide. When turning towards our overall coverage, with respect to the current status of our rollout, we are seeing minimal change in our first and second dose coverage and currently experiencing very low throughput of first and second doses throughout the city. As of April 28th, 87.6% of the eligible population, which includes residents aged 5 years or older, had received at least one dose, and just over 84.3% had received 2 doses. Most movement amongst the second doses is among those 5 to 11-year-olds, where our first dose coverage for 5 to 11-year-olds is now 53.4%, and our second dose coverage is at 38.1%. However, turning and looking at our third dose coverage, third doses have been administered to just over 54% of the Hamilton's population ages 12 years or older. When looking at our third dose coverage, just at 18 from the 18 plus, third dose coverage is approaching 58%, with us observing higher coverage in the older age groups. For example, third dose coverage amongst the 40 plus year olds is at 67%. In the last week, 875 third doses were administered. And finally, looking at our fourth dose coverage, currently our fourth dose coverage amongst the 60% population is 15%, but is higher in the older age groups. For example, 25% of the 80 plus year olds have received a fourth dose. However, when looking at our coverage rates, it's important to note that many people aged 60 plus are not eligible for fourth doses yet, 140 days past dose 3. Amongst those eligible, our uptake is currently at 65%. Next slide. In turning and looking towards our an operational status update, when looking currently at current vaccine eligibility and interval, since our last session together in April, the province has expanded the eligibility for fourth doses or a second booster to now include individuals ages 60 years of older and First Nation, Inuit, and Métis individuals and their non-Indigenous household members ages 18 years of age and older. Individuals are recommended to receive their fourth dose 5 months post third dose, as emerging evidence indicates that a longer interval between vaccinations is associated with a better immune response. With informed consent, individuals can receive their fourth dose as early as 3 months post third dose. We also wanted to highlight the current recommendations around receiving vaccination post COVID-19 infection. Currently, individuals aged 5 years or older who have had COVID-19 before receiving their first or second COVID-19 vaccine dose should receive their first or second dose 8 weeks after the start of symptoms or the date of their positive test if they didn't have symptoms. For individuals 12 plus who are looking to receive a booster, a third dose, or those eligible for a second booster or fourth dose, the recommendation is 3 months after their symptoms started or receiving a positive test results. Next slide. As we wrap up the COVID-19 vaccine update, again, as Michelle highlighted earlier in the presentation, want to continue to highlight the importance of staying up to date with your vaccines. We do know that COVID-19 continues to circulate in the community, and due to waning immunity from the COVID-19 vaccines, it is important to stay up to date. COVID-19 vaccines are widely available throughout the community. This includes our public health-led mobile clinics and Lime Ridge Mall clinics, as well as a number of other community-led clinics through primary care, community health providers, through neighborhood pharmacies, as well as we continue to have excellent support in the city through the GoVax program. In addition, for those eligible for our grade 7 and 8 catch-up clinics, that work is ongoing at our Lime Ridge Mall. As a reminder, these opportunities are open to any student in grades 7, 8, 9, or 10 who require hepatitis B, HPV, and/or meningococcal vaccines. And that's the update for today. I'll hand it back over to Michelle, I believe.
Thanks, Melissa. And at this point, that's the end of our presentation. Thank you.
Okay, thank you all very much for your thorough presentation as always, and important information for sure. We have a couple of folks that are interested in some questions. I'm going to turn it over to Councillor Ferguson and then Councillor Powers, and then anyone else that might please indicate in the chat or otherwise. Councillor Ferguson.
Thank you, Mr. Mayor. And I'll start with you, Michelle, and you could bounce the question off to someone else if you'd like. But what you presented today was very encouraging, especially around the hospitalization side, because in the media, we're hearing something entirely different. I heard Rob McIsaac at the opening or the quick-size sod turning ceremony for the new Grimsby Hospital, saying that the situation with COVID-19 in the Hamilton Health Sciences hospitals is at the worst level since the pandemic started. And so there seems to be a disconnect from what he was saying and what you said today. Any explanation for that?
Thank you.
Yes,
Bill?
through you, Mr. Mayor. So on that question, so the issue at hospitals is they are still seeing hospitalizations, as you would have seen through Aaron's presentation. Hospitalizations for us is a lagging indicator, so we might say that we're having some good news in that we're seeing that transmission is declining, our case numbers are declining. Unfortunately, hospitals are still feeling the impact of COVID, be it from patients that they have in their hospitals, but they're also quite strained from a human resources perspective, and we are hearing that across our hospitals and ultimately long-term care as well. It's an issue across the health sector. We're seeing it ourselves. And so it's not just the numbers of people in hospital, it's the delay they're already behind, from COVID over the past 2 years. And so they're seeing some significant issues there. And on that, I'm going to turn it to Dr. Harvey in the event he has something he wants to add. I see his camera on there.
Thank you.
Yeah, we've worked long enough with one another, Michelle. We read one another's minds. Through you, Mr. Mayor, I think the other addition that Mr. McIsaac identified is staffing. The hospitals and the healthcare system are reeling with staffing, and it's really multifold. Certainly part of it is there's staff members or family members that have COVID or have COVID symptoms and therefore aren't able to come to work. But I think as Rob highlighted, and I've heard it through many other avenues, is a number of people, many of them being nurses, have just taken COVID as the opportunity to step out of the profession. Many of them were qualified for retirement, and some of them actually, I think, have burned out of the profession and are looking at doing something else. And then the flip side of that is being able to recruit new employees. And then even the few that they're able to recruit, you have to onboard them. So I think the virus has certainly made things worse. But I think what you and I heard President McIsaac talk about at that media brief, Councillor Ferguson, was the health human resource crisis that HHS certainly is feeling itself in. And I don't think it's unique to HHS.
Mm-hmm. Thank you. Councillor Ferguson.
Okay, because I do see in the paper this morning they're canceling surgeries again, and yeah, I think you're right, Bart, that a lot of it has to do with staffing levels, particularly those. If someone they've been close to gets COVID-19, they have to step out for a number of days, so they're having terrible shortage of staffing issues for the reasons you described. So. I just want to be able to explain it properly when people hear this disconnect out in the community. And I'm speaking to a club on Thursday, and I know that question will come up, so I appreciate that. And Mr. Mayor, one more positive thing. I got my second booster, my 4th dose on Friday. And since they've reduced the wait time after the injection to 5 minutes, I was in and out in 10 minutes. So amazing service, amazing efficiency. And I just want to congratulate you on that. So that's all I got, Mr. Chair.
Thank you very much. We've had 2 years worth of experience in terms of delivering vaccines. So the staff are super efficient, and ready and willing and able to provide vaccine for just about anything, first, second, third, or fourth doses. So thank you for that. And certainly that's a positive message the community needs to know. Councillor Powers?
Thank you, Mr. Mayor. I have two questions for Melissa, please.
Yeah, go ahead.
Melissa, you talked about, and this was, we're now talking about the 4-shot, the second booster, one and the same. You mentioned the interval, the preferred interval, but then you talked about informed consent. Can you just explain what that means? Is that something from a physician that recommends that the shot be taken earlier rather than the preferred interval? But an answer, please.
Thank you. Melissa?
Certainly. Through you, Mr. Mayor, to the councillor. Great question. So the ministry, as I spoke, strongly recommends the interval at 5 months post third, between your third and fourth vaccine. However, individuals can choose to receive it earlier. So with informed consent, that does not require a letter from a physician. It would just be a conversation with a vaccinator at the clinic who would advise, again, that we are seeing that studies are showing the immunity is better at a longer waiting period, so at the 5-month period. So the vaccinator would just go through the pros and cons of vaccination at 3 months, and then if the individual chose to provide informed consent based upon knowing the risks and the benefits of vaccine at 3 months, then they would proceed with vaccination at that time point. So no physician letter required.
Thank you, Melissa. My second question is there a quick and easy place that we could go to find out where you can get your second boosters? Like I went into my community drugstore and they're not giving those yet. Is there some place that the public can link onto to see where they can either register or go to in order to get that second booster?
Thank you.
Yes, certainly. Through you, Mr. Mayor, to the councillor. So for the pharmacies, there is a link from I believe from our COVID-19 vaccine website, or you can just look up Ontario pharmacies. It's the pharmacies that are managed directly by the province. So it's a provincial website that lists all of the participating pharmacies in the province. So you can search via Hamilton, and it'll state who has the vaccine.
And what about ours? What about the city's supplementary?
And yes, certainly. On the city's COVID-19 vaccine website, it's under the Getting Your Vaccine section. There is a long section which highlights the mobile clinics for the week, as well as the hours of operation for the Lime Ridge Clinic and any other community clinics happening and their schedules.
Is there a number that can be called, Melissa, to book an appointment?
Yes, you can also call the City of Hamilton Vaccine Hotline, whose number is also on the webpage as well. And you can book an appointment through our hotline, or you can book an appointment online through the City of Hamilton's booking site. Appointments at this time and point are only required for the grades 7 to 8 vaccines, as well as the 4th dose booster. All other appointments are available on a walk-in basis.
Thank you.
Thank you, Mr. Mayor. I would just suggest perhaps a blast out to the councillors and their offices so that if we get these inquiries of the public, we've got it very handy in front of us. So it would certainly be helpful for my office and myself. Thank you very much, Melissa.
All right, thank you. Councillor Pearson.
Thank you, Mr. Mayor and Melissa or Dr. Bart. So my first question was answered by Councillor Ferguson, or Councillor Powers. Thank you for that. My second is just because I thought it'd be a good time to do an update. We're hearing more and more people getting COVID in the communities. You know, they're at home and etc. Can you just differentiate what are the symptoms that people can expect they're going to get with the COVID?
Thank you. Michelle, maybe from an update, or Dr. Bart.
Yeah, I'm happy to jump in, Mr. Mayor. I think the symptoms have remained the same. Feeling, and they're not very specific, but I think, people that have a fever, headache, feel run down, I mean, as Michelle highlighted, really, if they're feeling off, they're not feeling well, they should stay home, period, whatever it is. A number of people are utilizing rapid antigen tests to determine, I'm not feeling well, I wonder if it's COVID. The rapid antigen test can give you some indication. No test is perfect. I think many people have recommended, and I wouldn't disagree, that you really shouldn't rule out COVID as a possible reason unless you've done 2 rapid antigen tests 24 hours apart and both of them were negative. I think that reduces your likelihood. But again, if you're not feeling well, then stay home until you're back to feeling kind of 100%, and even give yourself, if you can, a 24-hour period after that, just to make sure that that you are really recovered.
Wonderful.
Thank
you for that, Dr. Harvey. I really appreciate it. I think it's important for the public to know. It just seems symptoms of, I know it's out there in the community, and it just, you question, was it really COVID? So I really appreciate that. And I think we've come a long way, Mr. Mayor, if I could just comment. We have come a long way, as you said, since the beginning. We were inundated, as all of council, with calls of, people trying to get in for their first shots way back. And now, there's so many other avenues available for people to go and get the shots. I can go to my Shoppers Drug Mart right now, but I'm going to wait the 5 months, which is coming up shortly. And, there's a lot of things have come along the way. Noticing as well, and to our medical officers, our health department, et cetera, working with all the grocery stores. When I go in, I see that they have the antigen testing kits available free. You can just ask and they give them to you. So as I say, we have come a long way. It's been a learning experience, and I've told people from day one, there isn't a book written on this, but hopefully we blogged it for, hopefully another 100 years we don't experience it. But we've certainly come a long way. I want to thank everyone.
Yeah, thank you. Councillor Danko.
Thank you, Mr. Mayor. Just for a moment, if I could we circle back to slide 14, which is the severity indicators by vaccine status. So my first question through you, Mr. Mayor, is just when we're talking about vaccinated versus unvaccinated, my understanding is vaccinated would be 2 doses or more.
I'll jump in. I don't know if Aaron wants to pull up our favorite 3-part plot there, Aaron. So really, at this point, vaccinated would mean you've received at least 1 dose. I think I agree. I definitely agree with what I think you're implying, Councillor, is 1 dose really worthwhile? And I guess I would say it's probably better than no doses, but I'm not sure how much better than no doses. As we've highlighted, and I'll jump on the horse as well. I mean, people knowing how many vaccine doses they're eligible for, and making sure that that they've received all that they're eligible for, then they know that they're, quote unquote, as of today, fully vaccinated.
Thank you.
Thank you. So I'm just trying to figure out, because there's a number of ways you can interpret these charts when you have 4 graphs on each one. So my understanding is that all of the vaccines that were approved, in order to consider that you had a full round of vaccination, that you were fully vaccinated, that'd be 2 doses or more. So if we were to split these graphs, the vaccinated with 1 dose and the unvaccinated statistically could be considered together, and then the vaccinated with 2 doses and 3 doses could statistically be considered together. Is that a reasonable differentiation?
No, I don't think I would do that. I mean, I think the graphics probably tell you don't do that because, while 1 dose seems like really minimal, the experience we've had. So essentially, just to orient, we've taken the entire population of Hamilton as they're eligible for vaccination, and we've determined how many of those, about 550,000 people, or it's less than that because we take out the under 5s, have received no doses, 1 dose, 2 dose, 3 dose. So that would essentially be our denominators on each of those 4 groups. And then we've looked at, so I'll stick with the hospitalization ones. How many people have been admitted to hospital for COVID-19? And of those people, what was their vaccine status? So that becomes the numerators. And what we have here is 4 rates of hospitalization stratified by their vaccine status at the time of hospitalization. So for me, I think if you started merging groups, if I look at hospitalization and intensive care, and I agree with Aaron that with fatalities, the numbers of fatalities, fortunately, are so small. And then when you start to divide them by vaccine status, these rates become very, very unstable and imprecise. And I think that's why we're seeing, the one picture from fatalities is being vaccinated is a good thing, because clearly the rate of death due to COVID is much higher in the unvaccinated than it is in any of the 3 categories. But I think if we look at the other 2 groups where we do have larger numbers, you're seeing a clear pattern here that with each subsequent dose that you're receiving, and it's clearly too early to even think about entering, a 5th bar here for the 4th doses, but I would see that coming at some point in the future, that clearly you're getting, dare I use the S word, a significant benefit or a significant protection with every subsequent dose of vaccine that you're receiving. So I would leave them as they are. I wouldn't do, I think you're losing information if you start to merge any of these groups with the other groups, because to my eye, and I think if I looked at it statistically, these are all different measures from one another.
Thank you. Councillor Danko.
Thank you. No, I appreciate the nuance that's involved in what's presented here, and that it's simplistic to add these together just to kind of group vaccinated versus unvaccinated, and the clear, as Dr. Harvey has stated, the clear benefit for each subsequent dose of vaccine. But one further question through you, Mr. Mayor, is this idea that I've been hearing that the majority of people in hospital are vaccinated. So when I'm looking at hospitalizations, it kind of depends on how you interpret that chart.
Yeah, I don't know where you're hearing that through you, Mr. Mayor. We haven't heard that, and and I guess I should highlight, I know Aaron mentioned it and I haven't, is these depict our experience since December 1st. So this is really Omicron experience only. This doesn't include, those historical experiences with Delta and Alpha and before. So this is really recent experience. Again, our experience, and we'll go back and look at whether there is actually a trend from December 1st through to May 1st that, that these protection levels are differing, but that's not what we're seeing in the data.
Thank you.
I know that lots of people have used anecdotal explanations to try to debunk the vaccine, but quite frankly, it just doesn't line up with the data the way we're seeing it.
Thank you.
Thank you. No, I just really wanted to hear that on the record, because it is frustrating when we receive, misinformation and conspiracy theories from really unreliable sources. So to see it indicated here and to hear it from Dr. Harvey and from our medical officer of health specifically is very helpful. Thank you.
So Mr. Mayor, if I may, so there is one other nuance here, and that is that fortunately the unvaccinated is a minority in the population. It's about 15%. So by definition, the majority of the population has been vaccinated. So even though their rates are lower, because there's so many of them, if you went in and you counted people in hospital, but again, it's the unvaccinated that are in hospital are representing such a small portion of the population. They're over-representing themselves as hospitalized people.
Thank you. Okay.
Thank you.
Councillor Danko, thank you. Dr. Harvey, thank you. Next question is from Councillor Pauls.
Thank you, Mayor. And I just want to pick up with Councillor Ferguson saying about the hospital shortage. I know that they have let go almost, I think, 200 people. I'm not sure the actual amount. And that is also one of the reasons why they're short. Essex County have family that live there. They had fired their nurses, and now they hired them all back because of the shortage. They had put out, I heard, ads, please, we need nurses, and people weren't signing up. So they literally rehired them all. I also heard in Collingwood the same thing, that they have hired everybody else. So I just want to make sure that, yes, people are leaving being nurses because of the stress, but also people have been let go and this risk is high. So, but I want to ask, I don't know who would like to answer that, Aaron or someone. The vaccine protects us from serious outcome. But I don't see any chart showing the transmission between vaccinated and not vaccinated. I went on the chart from the Ontario Minister of Health, and it shows people with 3 or more vaccine are spreading just as much as the unvaccinated. So I'm just asking Aaron or someone that brings this chart, why aren't we having a chart to show from the Ontario, I just saw it from the Ontario Minister of Health, showing that the vaccinated are spreading the virus as well. But we tend to talk about the vaccination, how good it is, how wonderful it is for your own health, which is wonderful. And let's promote that. But now that we are in a different area, 2+ years, we know most people are vaccinated and they're spreading it. And the issue is this, I go to nursing homes, where are our outbreaks? People that have had fourth, third, that's where our outbreaks are. So can we put a chart?
Let's get an answer to your question.
The question is, why
asked a
don't we have a
question.
chart for the vaccinated and the unvaccinated? We never seem to. We always say it prevents risk of getting sick. But I just want to know about the transmission. We never have a chart for that. And the
Thank
Ontario.
you. Let's get an answer to that question. Michelle or Dr. Bart?
No, I'm gonna jump in, Michelle, if that's okay. Through you, Mr. Mayor, I think it's a great question, Councillor Pauls, and we continue to learn more and more every day. So I think the bottom line is, as the virus has mutated and evolved, the vaccines have become less able to stop transmission. I think the reality is we've also taken a turn. I forget when Dr. Moore announced it. It was several months ago. You know, monitoring cases is no longer the issue. What we need to monitor is what's the impact on our health system. So that's why the focus on ICU admissions, hospital admissions, and deaths is the severe. The reality is the third dose of vaccine actually does reduce somebody's risk of being infected by Omicron, even compared to somebody who already has 2 doses. It reduces the risk of transmission by about 61%. The challenge is that the current evidence is that protection only lasts about 3 weeks. So 3 weeks after you've gotten that third dose, you now have, as you've alluded to, Councillor Pauls, you have a pretty similar risk to being infected. So we're really not looking to the vaccines at this point because they can't deliver on this. They can't stop, or they're not a significant block in transmission. That's where the notion of physical distancing, staying home when you're ill, wearing a well-fitting mask. Those are going to be the things that are going to be the significant block. Where the vaccines continue to be really quite remarkable is as the chart depicts, that the more fully vaccinated you are, the lower risk you're going to be to experiencing severe disease. So a lot of vaccinated people are saying, yeah, I got infected. It felt like it was a bad cold. It wasn't a big deal. That's great. I think that's the power of the vaccine now. The power of the vaccine is not to stop transmission and not to stop the risk of becoming infected. It can't do it right now.
And thank you. And we talk right at the beginning. I don't know who started talking. I don't know if it was Aaron, but we take this our own risk. Now it's our own risk because we get vaccinated to protect ourselves. So my question is, what we did last week, firing, trying to dismiss people, it does not make sense anymore.
The wrong place, the wrong time. So this is not about that issue. This is about COVID-related questions.
And the COVID-related question
transmission.
is.
So we're not going to go there.
Okay,
And if you're going to continue to go there,
can I ask Dr.
I am going to cut you off if you don't stop.
I don't understand why you don't always seem to undermine my question.
I'm not undermining your question. I'm telling you, you're out of order and you're addressing an issue that was dealt with by council. We're not at council. Listen to me. We're not at council. We're not going to readdress the issue that you want to get to. You can do that somewhere else. We're not doing this here today at Public Health.
Okay, can I just say my last question, please?
You can ask a question, yes.
Right. So therefore, the unvaccinated, Dr. Harvey, the vaccinated, the 15%, or actually in the city, RO City, 6%, are actually not spreading the virus. Is that correct?
Oh, no, they would definitely spread the virus.
If they're sick.
Let the doctor answer the question.
The publication that came out last week from Professor Fissman and his colleagues, I think underlined that the unvaccinated continue to pose a greater risk to the vaccinated than vice versa.
Okay, and Dr. Harvey, if I get tested and I'm not sick, can I pass the virus?
Well, right from day one, we've known that people can have an asymptomatic or an infection without having symptoms. Absolutely. And again, that's why the maintaining physical distancing, wearing a mask, because you never know when you're going to come in close proximity with somebody who may look perfectly healthy, but they're spreading the virus. So having them wear a mask, having you wear a mask reduces the risk that virus can be transmitted.
But Dr. Avery, if I get tested every day, I get tested twice a week, whatever, can I be assured I could go outside and go shopping and not spread it?
I'm not sure that I feel comfortable assuring anybody of anything for sure. And I'm not sure that, I don't think that we would be advocating that a reasonable strategy of moving forward with COVID is having large numbers of people test themselves on a frequent basis. I think testing, we're not going to test our way out of this. I think that's why the province has changed to a strategic testing process so that it's really people who are in vulnerable populations and who may be eligible for some of the treatments are the only ones that really are getting tested now.
Thank you. Okay, that's time for you, Councillor Pauls. If you have more questions, I can put you on a second time. I'm going to turn to Councillor Clark.
Good morning, Mr. Mayor. Good morning, Doctor. I just have one question. Do we know if the virulence of the virus has changed? Has it weakened? Has it gotten stronger? I know all these variants that are happening, but where would we sit today with how aggressive this virus can be?
Sorry, I'm chuckling because I was attending a meeting with some of the folks that have been studying COVID and its mutations, and the use of singular doesn't work anymore because there's so many genetic variants that they've identified. I think what we've experienced so far is the Delta variant appears to be the variant thus far that's been the most severe. So the larger proportion of people who have been infected with it have experienced severe outcomes. So much higher chance of needing hospitalization, much higher chance of really feeling quite ill. Omicron flipped the script on Delta. So the last statistics I saw was Omicron transmits close to 30 times more effectively than Delta. And now that I think about it, that was BA1, and BA2 is even 50% above that. So BA2 probably transmits 50 times better than Delta did, but it's only a fraction, maybe 10% or 15% as severe. The reason we saw as many hospitalizations during that first BA1 Omicron wave was because we had so many more infections. And even though the rate or the risk of needing hospitalization was much lower, because there were so many more cases, we ended up with so many more people hospitalized. So I think Omicron right now is a less severe virus, but a virus that can be transmitted so much more effectively. And as Aaron alluded to, one of the things in the wastewater is, because people seem to have on average twice the amount of virus when they get infected with BA2 as compared to BA1, the original Omicron. And so when we're measuring, or when that's being measured in the wastewater, we're actually seeing wastewater signals that are twice as high as they were for the original. And it's because there needs to be a corrective factor that's mixed into that. So severity, hopefully it never comes, but it doesn't look like it's going to come for Omicron. So we're going to have to wait for a variant of the future, and hopefully we'll duck it forever.
Okay. Councillor Clark.
Thank you, Mr. Mayor. Thank you, Doctor. Just a quick supplemental. Not sure we're going to see the end of COVID-19. I suspect the viruses are going to continue to mutate. But at some point in the future, will we be looking at what we did well, what we could have improved in our handling of a pandemic? Because my fear is that we could see an increase in these types of viruses that are crossing over from animals to humans, especially with the climate change impact on our jungles. So do you have any thoughts on that?
Sure. So internally, we've already started doing that. I was at a meeting earlier this morning, kind of planning on who we're going to talk to and who we're going to debrief. So within Hamilton Public Health Services, we've already begun to gear that up. And I agree with you. I would not be surprised if we find, as we did for the original SARS back in 2003, that both the provincial government or multiple provincial governments and the federal government may want to do some kind of formal review, even a formal inquiry like was done back in 2003. My guess is that there's still a few things to be done before you try to wrestle all those resources and also people that are out in the field that are still managing it to be able to give meaningful response. So I'm not sure that I see it in 2022, maybe in 2023, but I agree with you. I think those are definitely coming, and certainly us internally, we've already started to do a bit of a,
Thank you.
Rethink.
Yep. Councillor Clark.
That's it, Mr. Mayor. Thank you for your time.
Okay.
Thank you, Dr. Harvey.
Thank you very much. Who is the deputy mayor for this month, might I ask? I'm not sure who it is at this moment that I need to turn the chair over to. But let me turn it over to Councillor Nan if she's available, knowing that she
Councillor Wilson for the month of May, Mayor.
Okay. Thank you, Councillor Wilson. And if you would take the chair for a moment, just in terms of making sure our process is pure.
Good morning, Mr. Mayor.
One of the details, that keeps reoccurring and the message that keeps coming forward is continue to stay up to date with vaccines is the path forward on this. I don't need an answer to that. I think that's pretty plain and clear in terms of the messaging. The one thing that we kind of went over, and I'm not so sure it resonated particularly well, is that we're still anticipating, and I think it was one of our other presenters indicated that there's an anticipated 42 additional deaths that are anticipated by the end of June. Which is significant, notwithstanding, the age bracket or whatever age bracket it is. That's a significant number that no one should really gloss over. And I don't suggest that yet you did, but it kind of jumped out at me as still a pretty concerning, significant reason why we continue to want to ensure that people get vaccinated and stay protected and minimize the opportunities for spread. So I'm seeing in the chat that it's by end of August, which either way, still a significant number. So does anyone want to just kind of reaffirm that message that I think was part of, was it Ruth Sanderson's presentation, Ruth?
Good morning, Ruth.
Hi, sure. Yes. Thank you for the opportunity to reaffirm the message. So the forecast predicts approximately 42 additional deaths between now, May 2nd, and the end of August.
Yeah, I mean, that's
if I may, Madam Chair, also, Mr. Mayor, I think Aaron mentioned that right now we're at an average of 0.1 death per day. So let's make that more easy to understand. So you're right. At this point, we're seeing one death due to COVID every 10 days in the city of Hamilton. I think largely it's in the 80 plus, and I think that's understandable as, the resilience of each of us as we get a year older just becomes less. And, sometimes the getting infected with COVID and having your body have to respond to that. For some people, it's kind of the final assault that their body just, with all the medical support possible, it's not possible. But I agree with you. And that's why we've continued highly recommending kind of all of the actions that we believe will reduce the transmission of the virus. And it's why long-term care homes and hospitals continue to be special settings where the province is still mandating that masks be worn because of the importance of those settings and the susceptibility of people that are living in those settings.
Thank you. I hear the statistic that it's generally 80 plus, but not exclusively, I would think, even though it might be the preponderance. Either way, those are significant health issues that no one should dismiss as not being important or, not something that we should continue to protect against. So I appreciate the clarity on that. And I think it's critically important that we continue to encourage everyone, and specifically in the booster side, which we're not necessarily seeing a significant enough uptake that we continue to promote people keeping their vaccinations up to date, which now is starting to land itself to fourth doses as well. And so that level of encouragement, I think, needs to continue if we're going to continue to protect as much as possible from that kind of a serious outcome, and death is a serious outcome. Thank you for that. I appreciate that. I will take the chair back, and for a second time, we have Councillor Pauls.
Over to you.
And thank you, Mayor. And obviously, every death is heartbreaking. Every single one, whether you're 80, 100, it's heartbreaking. But I want everybody to know that these people in nursing home and have third, fourth vaccination. They've been protected by vaccination. So, and the people that go and visit them, they need their third shots to go in. So I do not know where the spread is coming. But my question to the doctor is, we do follow the signs, Dr. Harvey. Our federal government health, Theresa Tam, said it's time we live with it. It's time we figure it out what's going on. Dr. Moore said the same thing. There's other doctors that are saying this virus, after 2 years, we know what's going on. We know shots, vaccines.
So,
So I'm just asking you,
your question?
what is your thought on Theresa Tam and Dr. Moore and others that have said, even Dr. Bosch, he also said it's unforeseeable to say that we have to have 5, 6, 7 vaccines constantly. So I just was wondering what your thought is on their views.
Thank you.
I mean, I hear clips about them, and sometimes I'm in meetings with Dr. Moore. I think the virus is really like, we have about 2.5, humanity has about 2.5 years of experience with this virus. And actually, as Councillor Clark and I were, or as I was responding to his question, the reality is even that's an illusion, because this virus demonstrates that it is very capable of mutating, and it is mutating. So, you know, the Delta virus that we saw last fall is totally different than the Omicron virus that we saw at New Year's, which really its subvariant of BA2 is different than the BA1. So I think anybody that says we know this virus, I guess I'd have to ask them what they mean by that, because this virus is going to mutate and we're going to get another variant, and we're going to have to stay nimble, and we're going to have to continue to collect information, process information, and figure out where the best balance is between encouraging people to make individual decisions. But I don't rule out that, you know, the decision makers, I'm an advisor, I'm not a decision maker, and I'm happy to be that. But the decision makers, like provincially cabinet, may have to bring in lockdowns in the future. I don't know that. I kind of play it day by day because there's so many changes going on. So I respect Theresa a lot, Theresa Tam. I respect Kieran Moore. I enjoyed working with them when I was in Kingston with them. And I respect people like Isaac Bogosh and Zane Shagla and all of the other folks that are trying to follow this, and collectively we get the best science possible. But science by definition is uncertain. So we try to be as informed as we can, but be prepared for the fact that a month down the road, we might look back and go, man, did we miss that one? Now, how do we adapt to kind of minimize the risk?
Okay, thank you, Doctor.
So you're saying we ourselves, then we should count the risk. It's our own risk. And until, you know, this is hard. It's not an easy discussion we're having. And I've received a lot of emails of people that are saying they're at the end of their rope. And that concerns me a lot. I saw an article of a boy, 15 years old, committed suicide because he was bullied because he wasn't vaccinated. It is sad. So to me, vaccination, we say yes. Most of us are vaccinated. Good. We keep doing it, but we also have to follow our Ontario counterpart. So I appreciate your answer. Thank you.
Okay, thank you. I see no further speakers at this point, so could I have a motion to receive the presentation, please? Moved by Councillor Clark, seconded by, not seeing everyone on the screen at the moment, so we need to know that there's quorum in the room. So if you'll all pop back on, if you would. And seconded by Councillor Powers. And Madam Clerk, can you confirm that we have quorum at this point so that we can receive?
Yes, we do have quorum.
Okay, thank you. So I'll ask for the vote then. All in favor of receiving the presentation? Vote is up. And Councillor Powers, I see thumbs up. Anyone else need to do a manual vote?
Mayor Eisenberg, I do as well, please.
Councillor Pauls?
Thank you. The last one was Councillor Wilson or Councillor Nan? I'm not sure who was the manual vote on that one.
It's not showing up. I'll put my thumb up.
please?
Okay.
Councillor Nan for
Thank you.
manual.
Thank you.
Vote is closed, and that carries 11-0.
All right, thank you very much. There are no further additional
Mayor
items.
Eisenberger,
Yeah,
my apologies. Sorry, the screen shows me as absent and I voted to approve and eScribe won't let me vote.
Okay. Thank you. If you could either correct the record, Madam Clerk, or we could do a revote on that one.
I have just marked Councillor Nan as of being in favor of the presentation.
Okay, so that indicates the chief's presence. All right, thank you. Any further comments or questions on any of this? If not, a motion to adjourn would be appropriate. Moved by? I can't see anyone on the screen other than Councillors Nan and Pauls at this moment, so I'll take Councillor.
Be happy to move it if you like.
Thank you, Councillor Ferguson, seconded by Councillor Nan. All in favor? Last vote for this meeting. Thank you. And thumbs up from Councillor Powers. And thank you to all the presenters. You know, we've received really helpful, very important information from all of our presenters on an ongoing basis. I want to thank them for their ongoing effort, and of course the good work of our public health. So the work continues, and you know, we're not done with this virus as much as we'd like to be, but the work continues, and we'll continue to do everything we can to protect people in our communities. Thank you all very much. Adjournment is approved, and thank you for your attendance, and have a good meeting this afternoon.